Tamsulosin is used by men to treat the symptoms of an enlarged prostate, benign prostatic hyperplasia. It does not shrink the prostate, but it works by relaxing the muscles in the prostate and the bladder. This helps to relieve symptoms of BPH such as difficulty in beginning the flow of urine, extreme, and the need to urinate often or urgently, including during the middle of the night. Tamsulosin belongs to a class of drugs known as alpha blockers. Do not use this medication to treat high blood pressure. How to take? Tamsulosin comes as a capsule to take by mouth. It is usually taken once a day. Take Tamsulosin 30 minutes after the same meal each day. Follow the direction on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take Tamsulosin exactly as directed. Do not take more or less of it, or take it more often than prescribed by your doctor. Adults over 80 years of age and elderly patients. Inside, after breakfast, with water. Take one capsule one time per day. The capsule is not recommended to be chewed, as this may affect the release rate of the active substance. In patients with impaired liver and kidney function. In case of renal insufficiency, as well as in mild and moderate hepatic insufficiency, no correction of the dosing regimen is required. Contraindications: hypersensitivity to tamsulosin or any other components of the drug, sucrase, maltase deficiency, fructose intolerance, glucose-galactose malabsorption, orthostatic hypertension, including history, severe liver failure, children aged up to 18 years. Precautions: before taking tamsulosin, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of low blood pressure, certain eye problems, cataracts, glaucoma. Older adults may be more sensitive to the side effects of this drug, especially dizziness and low blood pressure when getting up from a sitting or lying position. These side effects can increase the risk of falling. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. What side effects can this medication cause? Tamsulosin may cause side effects. Tell your doctor if any of the symptoms are severe or do not go away. Sleepiness, difficulty swallowing asleep or staying asleep, weakness, back pain, diarrhea, runny or stuffy nose, pain or pressure in the face, sore throat, cough, fever, chills, or other signs of infection, blurred vision, difficulty ejaculating. Some side effects can be serious. If you experience any of the following symptoms, call your doctor immediately. Painful erection of the penis that lasts for hours, rash, itching, hives, swelling of the eyes, face, tongue, lips, throat, arms, hands, feet, ankles or lower legs.